This is a very interesting case. This patient had pain on the lower right. You can see a previous root canal on tooth number 30. The limited field of view, look at this defect in the furcation. It is literally blown out, and the concern was there a vertical root fracture in that distal root? So we did a limited field of view 3D CBCT, and we're trying to identify if there's a vertical root fracture, and we don't see one. So as we look here, this axial slice, look how blown out that furcation is here. And we took a view from the distal, and we noticed that one canal was filled and the other canal was missing, leading to this large peripheral pathology. And then we took a look at the mesial root. Everything looked great on this mesial root. So we decided to do what we call a selective retreatment on this case due to the area of pathology, mainly on that distal root, due to that missed canal. So we cleaned everything out. This is our cone fit. We used bioceramic sealer. We obturated this case in one visit in the selective retreatment. Patient did well. They came back 2 years later in 2024. The dentist thought tooth number 30 was the issue, but look at this bone healing on tooth number 30. The bone is healed all the way in the furcation. So tooth number 30 is doing wonderful. And look at this distal root. Look at all that healing there. The healing is amazing on this case. And this is a selective retreatment case. But the question is, where in the world is the pain coming from? We did an axial slice here, and look, all that bone has filled in the furcation, and we obturated that extra canal. The mesial root is still doing well. Well, come to find out, this patient actually had a fracture on tooth number 31 right into the pulp. So we had to do a root canal on tooth number 31. This is a cone fit. We obturated with bioceramic sealer, single cone condensation in one visit. Patient was completely asymptomatic. This is before and after, so you don't want to jump to conclusions. Make sure you use your CBCT.